Margaret Russell is a second-year family medicine resident at Northwestern University's Teaching Health Center program at Erie Family Health Center in Humboldt Park. She is doing an area of concentration in HIV care and is passionate about improving health for LGBTQ+ patients. She is also completing a master's degree in medical humanities and bioethics and is working on a research paper in patients' preferences regarding advanced care planning discussions with their primary care physicians. Before she started her career in medicine, she worked in theater, including teaching and mentoring for theater programs for children with disabilities and stage managing with Cirque du Soleil. So without further ado, I welcome Margaret Russell.
Thank you very much. So I'm going to be talking about cultural humility and vaccination for LGBTQ+ families and patients. And so before I get started with that, I would like to just talk about what exactly we mean when we talk about LGBTQ+ patients. LGBTQ stands for lesbian, gay, transgender, bisexual, and queer. And when we're talking about that, we're talking about people's gender identity, gender expression, their sex assigned at birth, and as well as who they're sexually and romantically attracted to. So this graphic here is the gender unicorn. This is a way that we think about all those different aspects of who a person is, a person's identity, and how those things interact with each other. For most people, this is a spectrum. So you can have different amounts of feeling feminine or masculine, and also the way you express yourself may be more feminine or masculine. People feel different amounts of attraction to people of one gender or the other. And also to people who may express their gender differently. When we talk about sex assigned at birth, we're talking more about people's genetics and what sort of anatomy they have. But people of all anatomies and all genetic makeups may express their gender differently, may experience their gender differently, and may be sexually or romantically attracted to people of different genders. Another thing to keep in mind when we talk about LGBTQ+ people is that though there is sometimes some things that they have in common, it's a very, very diverse group of people. So this is just logos from a sampling of the organizations in Chicago that specifically cater to people who identify as LGBTQ and also some other cultural identity. And this is by no means an exhaustive list of all the organizations out there, but it's just a reminder that people have other identities as well, that they may be making a bigger influence on their decisions about healthcare. So what do we mean when we talk about LGBTQ+ families? Some things we really need to be thinking about as healthcare providers is our images of family, not only what we think of ourselves when we think of family, but also what sort of imagery we're presenting to our patients of families when they come to see us. Because if this is the only image you have of family, some people may find that that doesn't represent their experience. So when your office is putting up pictures of families or creating handouts with pictures of families on them, think about if you're including families that look more like these families. Another thing to keep in mind is that unfortunately the medical profession has a long history of pathologizing LGBTQ identities. And even though there's been a lot of progress in the field, people still have either had personal experiences or historically know about other people who've had experiences where their doctors have not been welcoming and affirming of their identity. So we really need to try to be welcoming to LGBTQ people and their families when they come to see us. So some things to be thinking about is what imagery, as I just mentioned, does your practice use to represent families? Do the forms that you have people fill out when they come to see you allow for a variety of family structures? Do they say mother, father, or do they just say parent, for example? Do your forms ask a person's sex or gender and have checkboxes, male or female, or do you leave a little bit of space for someone to write in what their gender identity is? Are there gender neutral or family restrooms available for people to use if they don't feel comfortable using a men's room or a woman's room? Is there a place where somebody who doesn't identify as female can change a diaper? That can be important not just for LGBTQ families, but for any person who needs to change a diaper who doesn't identify as female. And are the staff trained to interact appropriately with LGBTQ plus individuals and families? Because even if you're a really sensitive provider, if people are getting the wrong vibe from when they walk in the door from the staff working at the front desk, that can be alienating as well. As far as in the exam room, so always try to use people's preferred names and pronouns, and if you don't know, ask. This is especially important because a lot of times the EMR will reflect what's on their driver's license or their birth certificate, but that may not be the name and the pronoun that they prefer to go by. Also, make sure to acknowledge social parents. We are very used to this when it comes to things like adoption, but if you have two women who are raising a child together, they are both the parent of the child, even if one of them gave birth to the child and the other one did not. Now, sometimes in medicine, we do need to talk about biology for medical reasons because of inherited genetic tendencies and illnesses. So it's important to just be clear with our patients when we're asking specifically about those sorts of things, but not intending to undermine the reality that someone is, in fact, the parent of the child, even if they're not biologically related. Another thing that to keep in mind, you hear a lot about pronouns and people's preferred pronouns, but what does that really mean? So a lot of times, most of us are familiar with the she, he, him, her pronouns, but some people prefer to go by they or them, a more gender neutral pronoun. And there have been other gender neutral pronouns that people have used at different times in different places that you may come across, such as she, here, her, and sir. Now, as far as vaccine recommendations for adults and adolescents, when we think about vaccination for children, really, the vaccination recommendations would be the same, no matter the gender identity of the parent or the child. However, when we get into adolescents and adults, there are some small differences, particularly having to do with people's sexual practices. So the HPV vaccine is recommended for women through age 26 and for men through age 21. However, for men who have sex with men, we recommend up to age 26 that they receive that vaccine. Something to keep in mind when you are counseling your patients is you may inadvertently out somebody's sexual orientation by making this recommendation. So think about who's in the room with them and whether they know that person's sexual identity or not. Now, vaccination rates among men are actually lower for the HPV vaccine, which is unfortunate and something we all need to work on. Only about 8% of men receive at least 2 doses of the HPV vaccine compared to 56% of women. We also found that women in rural areas who identified as lesbians were less likely to be offered the HPV vaccine in some studies. Another important piece of information is that there have been studies of men who have sex with men that have found they are overall open to receiving the HPV vaccination if it's offered to them and recommended by their doctor. Another thing to keep in mind is that we are currently recommending the meningococcal vaccine for all men who have sex with men in Chicago because of some outbreaks that have happened. So that's another vaccine recommendation to keep in mind for those patients. Hepatitis A and B are recommended for all unvaccinated men who have sex with men and those engaging in certain sexual practices. Specifically, these are practices where they might have any sort of fecal oral contact. So it is important if you're able to take thorough sexual histories and talk to your patients about what exactly they're doing. Also, as I mentioned before, just be aware that some of these recommendations could reveal someone's sexual orientation, and so you should be aware of who is in the room with them and if they know and are comfortable, if the patient's comfortable being open with that person.